Other questions? I can also job search with you guys if you really want before my computer dies on me. I think we have enough charge. Do you guys want a job search? We have 15 minutes. Yes? Okay, let's get the requests. What do you guys want to find or search for? What has been hitting you over the head lately that you wish you could find? We could search just health equity. If you guys want to look at this to see how to search for health equity work, go doggy, go. Okay, health equity, let's do it. Go doggy, go, go, distracting me, go. My dog takes up any opportunity to get pet and I'm trying it. I need my hands. Courtney, you have a question?
Yeah, I was just for the mentorship program. I have a question for
Go
that.
ahead. Go ahead.
Um, so let's say you get an offer, but then you turn it down because there's another offer that do you still continue if like an offer comes, but it's like not the right offer? I was like wondering when the
Oh, that's a great question, Courtney. Yeah, that is actually,
ship
that happens.
terminates.
Yeah, that happens actually because of the momentum we build. And sometimes you're in the space of, a couple offers or like you're waiting to hear back or whatever. The goal of the mentorship is to get you an offer. So if you get an offer, technically the mentorship is over. So like once that rolls through, but the good thing is you and I have already built a relationship. We already have each other's phone number by that time. And I actually welcome you to just call me as a needed basis. So what really happens is our weekly Zoom meetings will simply be canceled after the offer comes through. But if you need help with making decisions or how to stall or how to negotiate, I talk to my mentee still. It's not like we don't talk ever. So they still call me and be like, hey, this is happening. How do I handle this? Can you talk? Like they'll text me like, hey, can you talk? So that's fine. What really happens is I'm no longer helping you tailor the applications. I'm no longer looking for jobs for you. I'm no longer meeting one-on-one with you, right? But if you need to talk because things are still rolling in and now you're having to juggle a couple offers, we can still talk.
Okay, got it. So as once one official offer comes in, then it's like officially.
Yeah, once an official offer comes in, like in other words, they gave you verbally like, hey, you got an offer, we'd like to send it over, that kind of thing. That is officially now we don't need to do the weeklies. I don't need to review your applications anymore. You see what I'm saying? But you
Yeah,
can still talk to me. Be like, hey, Zoila, I have more questions. Hey, they want this now. Hey, is this weird? Hey, I don't know, but I'm fine with that. That
right.
that is totally okay with me. And that
Okay.
could happen. Yeah. Yeah, yeah.
Okay.
That's a
Cool.
great
Thank
question.
you.
I love to support my mentees. I get updates from a mentee of mine who is a returning mom to work. And I love helping moms return to work because they even have questions of like, is this normal? Like, is this like I haven't worked for a couple years, so I don't know if this is just how it should be. So they'll call me even like a month, 2 months in just to check in and be like, hey, this is what's going on. Happy to connect. Yeah, for sure. Great
And then
question.
sorry, I had another question.
Yeah.
Um, as far as your mentees, I know you like work with a wide range of people, but once they're enrolled in the program, like off the top of your head, what's like the average? Have they already been looking on their own, or are they starting the looking process with you?
Yeah, everyone ranges widely. I prefer that you've already been at least like warm, not like you've been in the master class, right? You know what we're doing. You've been applying a little bit. You know what you're getting yourself into. Most people that come to me are relieved to be working with me because they're like, I can't do this. Like I can't do this. Like in fact, I'm meeting again with a mentee who I onboarded yesterday. She wants to meet again because we were having such a great conversation. I'm like, let's keep it going. Because she's like, I've been drowning for 2 years and I can't get out of this. Like, so now we're working together. But then I'll meet other mentees who are like, hey, like things aren't looking good and I'm quitting my job and I'm exhausted, but I need help. I don't even know what to do with my resume.
Mm.
Okay, great. When you're ready, we'll meet. So I think I see it both. I see both. As long as you know that who you're working with, to me, it's like I just need you to know this is my style, this is the framework, right? I just want people to understand I'm coming at you not like your traditional coach. Like I'm not someone who's going to tell you apply 10 times a day. Like this is a different process. To me, that's really what I want you guys to understand. And I think everyone in this room would pretty much qualify for the mentorship because you know my style by now. Yeah.
Okay.
Yeah. So these are my notifications. Do you guys see my screen still? It seems like it stopped sharing.
Yeah, it stopped.
Okay, hold on. So I was just trying to leave my notifications so you guys can take a look at what like. This is where the job alerts usually come from. Occasionally, I've been trying to go on Indeed. Indeed is still good, guys. Don't give up on Indeed. You can still use these terms, but just so you know, this is how I set mine up. This is my job alerts on my LinkedIn. So if you don't have your own, please set these. Oops. There we go. So, and I have mine set for 24 hours. So like any day I want to go in, I can expect the freshest. Okay, so someone wanted health equity. So let's look into some health equity options. Right? So it's already automatic, remote, 24 hours. And I just go in there, shop around practically. Appeals and grievances is great. It's a great entry point. It's very high customer service. A lot of complaints you're dealing with, but it is good entry work. Not liking where health equity is going. It's not really PMP. Oh, that's another thing is I also want a space to promote more like certification information and where to go or where's your first stop. Um, so this one's not that bad if you guys have your PMP or thinking about it. Some of you can make the case for having like you have high project management skills basically without having a PMP. I've had mentees like get into those kinds of jobs because like they do clinical trials, for example, but they don't have a certification or anything. But that's high level project management. You're dealing with IRB and recruitment. Yeah, guys, I don't like searching health equity. Like I'm looking for health equity jobs, but not through health equity. That's the hard part. You have to find it through like what's another term? I know SDOH also hasn't been hitting like social determinants. Yes, Alicia, you have a question?
Yes, about the certifications actually. I was wondering
Yeah.
when you're talking
Yeah.
about the PMP without the PMP certificate. I feel like I have some of that too. So I was wondering on the resume, is it beneficial to just, you know, highlight your program management skills in it without saying you have a certification, or how would you go about that?
How do you just disclose it?
Yeah, I guess on the resume. How would
You
you?
could put it in the summary on the last line of your summary that says PMP certified by, or is it through
Well,
PM?
if you don't have it, sorry.
Oh, if you don't have it,
Yeah.
you state at the top, like maybe even if not the first line, the second line,
Mm.
um, expert, X years in project management, including. So you kind of have to
Okay.
describe it a little bit.
Got it. Okay.
Like that second line, if sometimes they tell you like the kind of project management, it'll like
Right.
be mentioned somehow of like, oh, they think of project management as like scheduling or dashboards or reporting
Mm.
or so then use that to kind of kickstart the description. Yeah,
Okay,
that's a good.
thanks.
Yeah. This is FHI 360, global health. LabCorp collection specialist, remote. Love LabCorp, but they're very much low pay. What the heck? And I think it's more billing or something. Yeah, billing collections. Yeah, health equity, social determinants seems to be a little better term. Housing coordinator, member liaison specialist. A lot of LA jobs also require Spanish speaking. If there's any bilingual in English and one of the CalOptima Health defined threshold languages. You guys will run into this. I'm honest because I've obviously am in California and I'm in LA and I've navigated this market myself. But if you want to work in Southern California and there's any like hint of member engagement or community engagement, 99% of the time they will want a second language. So if you want to work in LA, stay in LA or in Southern California, your best option right now is either look at remote, right? Or look at jobs that are not community facing. So now you're looking at administrative work, project management, data analysis, anything that's not like community facing. Because that's a big headache that I get with my LA mentees is this language barrier. But we find a way around it. A lot of my mentees in LA end up finding remote work for companies outside LA. So that's how we get around that. Okay, learning. Yes, yes. This is another great space I don't talk enough about. If you're interested in evaluation, you love evaluation, you love reporting, you love dissemination, you love publications, you love knowledge. There's a space known as knowledge management or learning. So I would encourage you to search those terms, knowledge management, learning. They're also called like on the global space, they're called MEL or meal, monitoring, evaluation, assessment, learning, or monitoring, evaluation, learning. So there's a couple ways that I've heard it described, but the learning space is something that you find a lot of companies need help with because they're either trying to help the workforce or their constituents or the participants or their own organization. Look at that, 60 to
Question about
85. Yes.
the learning industry. So, do they usually require like degree in evaluation or more formal background in that?
No, no, they usually want someone in management, like if you have business management, public administration, nonprofit management, or they just want like any bachelor's degree, they'll say. Like they don't really. Now, mind you, maybe you don't want to talk about schools. This one is for Charter School Growth Fund. It is a nonprofit, right? But they are looking for someone to help with their learning community. 60 to 85. The other thing is sometimes I see that they want you to have been a teacher or instructional design or curriculum design, and sometimes they don't. Like sometimes they just want someone who like manages pumping out the content and like, making sure that they're getting the information they need to keep the e-courses going. So it's not always that you have to design the content, it's that you have to manage to the outputs of the other team. Does that make sense?
Yes, that's helpful.
Yeah. So you have to read through it to really, I mean, I love this. Like, I'm sorry, 60, 85,000 remote. I'll learn about charters all day. No, it's not like your traditional public health job, but this is how you guys are going to survive, to be honest. For those of you who are worried, it's like, this is like sometimes you have to at least find a nonprofit that will support you, right? And give you skills. I know that's nonprofits to me have been my saving grace, where I'm like, I don't know how this is public health related, and it is. Like, if you're getting skills on a learning community and you can eventually fold this up to work at a healthcare hospital that's doing like continuing medical education units for doctors, working at City of Hope, $100,000 job, helping them with their learning environment. Like this rolls up into bigger things when you kind of take a step back. So just be mindful of that. Lots of part-time work. Lots of part-time work. Cannot speak highly enough about part-time. Yes, there's temp agencies. Yes, there's, side hustles, but part-time work is so out there. The reason that it's still available and popping is because companies can't really afford a full-time workforce, and they love part-time because, they really can put an endpoint to that, or they can just kind of gently let you go. There's no big commitment on their end with benefits and all of that. So I love part-time because it also gives you your time back to be able to search for a job. Please be mindful that looking for a public health job is a full-time job in itself. It is a full-time job. I have never felt like this is easy, ever. So if you feel like you're, either you're being let go or you have a full-time job that is like draining you, whatever the case is, as far as your time, just know that part-time is always, always a good safe haven. I've had to let go of full-time jobs to take a part-time job to find a better job. Like I can't, sometimes you guys are trying to do full-time job to next full-time job. It's like, you just can't. You can't because you're tired, you're burnt out, your boss pisses you off, the work isn't going well. You use your weekends just to rest. God bless you because you need it. When are you gonna apply to a job? I know some of you aren't here because you did that, where you were like, I had to let go because I couldn't do it. And so if you're feeling the financial pressures of like, okay, well, now I've been unemployed for 4 or 5 months and this job search isn't looking good and I've only gotten one call back, what do I do? Part-time, 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 part-time. Think about it. Think about it. Okay. I'll stay on a couple more minutes. Looks like the computer isn't going to completely let go. Let me show you equity and belonging. Let me see if belonging comes up. It's funny because when I look for them, I can't find them. It's always this roundabout way. Oh, I know why. Because it's 24 hours. There it is. There it is. There it is. Diversity, equity, inclusion, belonging. Equity and belonging. People growth and belonging. Employee belonging. Wow, this one's a DABE intern. Diversity, equity, inclusion, and belonging. Belonging, well-being, and inclusion. Director of belonging. That's it, guys. DEI is now, the term belonging is now being introduced so that these companies can keep their initiatives or that they can be excluded from whatever is happening with the federal administration. As you can imagine, you've probably been hearing how universities are trying to take a stand against what the administration is asking of them. I think Harvard has been in the news for that matter. So I'm just being transparent on what I see is some of these companies are trying to hold on to the work but that means they're going to have to change on how they define it. And that also means us following that. So that is an example of it. Okay, well, I'll leave us on that note. I hope this was helpful, inspirational, motivational, or at least just a cool place to hang out in your morning on your Tuesday. Have a wonderful day, everyone.